Hi, it's Arlie, and this is going to be a quick update on my gallbladder surgery. I've had a few comments about like anesthesia and stuff, and I wanted to address that, especially since I know the person said they were going to go into surgery soon. I don't know how soon, so I wanted to really get this out quick. If you haven't seen my gallbladder surgery story, I'll link it up there. I had my surgery done February 14th. All documented in my long video, so if you want to get that. This is about 6 months later. I didn't do a follow-up sooner because there are several things I still was kind of trying to work through. And I don't really think it's the surgery. Anyways, let me address the question I got first. Hopefully I can find this person because they deleted the comment, so I can't just reply back, which is another reason why I'm doing this video. And I'm not gonna blast your name out there. Okay, there was a few questions about being put under for the surgery. Of course, it's scary for everybody. What does it feel like? Honestly, it feels like you are just you kind of blink in a way. I've had another surgery that I had anesthesia with, and I've also been put under via IV for wisdom teeth, and then sedated pill-wise for dental stuff. And with the IV, it seems like, which of course is what you're going to get, they're not going to do anything other than that. It seems like as soon as they shoot it, it's like you see it go in, and maybe 3 to 5 seconds, you just black out. It's not like a scary blackout, it's just like you feel like you literally just blinked, and then when you open your eyes again, it's over with. It's crazy. The way I woke up from this particular surgery was concerning to me because they gave me some medication extra in my IV to go against any kind of nausea that I may have, because I had had surgery before and I had thrown up right after. I don't know if it's the meds they gave me for nausea or just the particular anesthesia. When I woke up from this one, it was really creepy for me because I was so used to it being another way. This one, I kind of could say, my eyes were still closed. I could hear everything around me. I could sense everything around me. So it's like I could visually in my head see where everything was, wow, my bed, there's a nurse over here, there's a nurse over here. So I came to, I wake up, but they're kind of in and out a little bit. But I wake up pretty quickly and I'm like, okay, it's over. It was pain, my stomach pain. And so I heard the nurse, she's like, okay, I'll give you something for pain. And then I was like, oh, nausea, nausea, nausea. And then I heard the nurse say, okay, I'm giving you something for nausea. And then I slowly was able to open my eyes. It was really weird because usually I just kind of blink and then wake up and I'm totally wide awake, totally alert. This time it was a weird kind of I couldn't see anything because my eyes were shut, but yet I was awake. I don't know if that was kind of typical people that wake up during surgery or not. I did not wake up during surgery whatsoever. That is very rare. I have heard that people with blood type O positive sometimes are harder to sedate, and that's the blood type I have. I know when it comes to actually putting me out for things, it seems like they have to give me extra dosage or whatever. Pain, they have to give me a dose to kill a cow or something. As long as you go in knowing that might be an issue, you can ask the doctor if he thinks that will be an issue, and he can maybe adjust things, I guess. You didn't have a picture, so I don't know your hair color, but if you're a naturally redhead, that also can make it harder to sedate and harder to treat for pain. I didn't wake up during the surgery at all, and so I don't want you to get that idea. It was just really weird that I seemed like I couldn't open my eyes right away. And then by the time the video cuts in with me having the towel on my head all dramatic, thinking I was gonna literally die. I was squinting because it hurt to talk. The lights were bright. I don't think they're really bugging me, but I was just kind of in so much pain. I just kind of was trying to just pull through it. And I know I was very dizzy and very like I said, I was throwing up and got really sick afterwards. So it was I was trying to pretty much close my eyes to make the room stop spinning. So that was what that was about. At least this is how it was with me, and this was how it was with me with my bladder sling surgery. They will have you hook up to IVs and everything, and you'll be awake as they roll you down to the operating room. And I know with both, The first one freaked me out so bad. They had me already like put on the operating table and under these lights, and I'm like, okay, did they forget I'm supposed to go under? What's going on? And then boom, out. And this one, they took me in, and then I had to get over to this other table, and this table was different. It had like, you had to have your arms out a certain way so they could do the IV. And as soon as they like put the arm things, and I think they may have had me put the thing in your mouth, like it's like a thing you have to hold in your mouth. You're just kind of like biting down on this like ring thing. It's kind of just to hold your, like, just keep like that. So where they put the tube down your throat, which don't worry about it. That's like not even a problem. I mean, worst case scenario, you get a little scratchy throat, that's literally it. With some medical tests I've had that I've been sedated on, it scared the hell out of me because I was still awake, and they're like, okay, put this in your mouth. And I'm like, I'm still awake. What? Come on. Why am I putting this in my mouth? Don't you do that after? But I guess a lot of times, or maybe it's policy now, you know, they don't have to, I guess, pry your jaw apart or something when you're under. I don't know. I had to be put on the other one, and they were like trying to get my arm on the thing. I just like not understanding what they were doing. I thought they meant put my arm down, whatever. I think they had me put the thing on my mouth, and then they had me inhale some stuff. And because I started counting, I was curious. I think I got to like 97 and I was out. How do they do it? They do it through IV. You already got IVs and like probably like fluid and some other stuff going in. Or they could just have your IV in your arm and it just be set up and nothing put in. I mean, I don't know exactly how your surgery, different hospital or everything else. So they will already have the IV in. It's just, you won't get the actual injection into your IV because it's something they inject until you're actually on the table or right before surgery, right? If that makes any sense. How does it feel when they put the stuff in? I don't think it really felt like anything. I've had tests where they had to put like dye in your veins, that would kind of make a tingling feeling, but this didn't feel like anything. I think you kind of are knocked out before you can decide whether or not it hurts or anything. They do use propofol, I can never pronounce it. But do not worry, it's very rare to have any problems with that one. Michael Jackson was like literally taking it like way too much and every day for who knows how long. So just for a surgery, it's not gonna be like dangerous. And also with that medication, as soon as they stop injecting it, you wake up type thing. So it's really quick to wake up after that. If that was not what they used on me, then I'm not sure what the drug was. But I know I've used that with a few other procedures and I think mother surgery. And if that is the case, I didn't feel anything. Another question was like, do you like, when they put the stuff in, do you get sleepy or is it more like wide awake to instantly out? I would say it's more like wide awake to instantly out. I mean, by the time you finally get back there, I know my surgery was late starting and I was already in so much pain I just wanted to freaking just ask for a scalpel and cut it out myself. So I was just kind of like tired, I was hungry, everything else. So I was just totally worn out by then anyways. But yeah, you're kind of scared. You want it to go ahead and start because you're just kind of like freaking out, which they can give you stuff for anxiety beforehand, so you're not as scared even going into the room. I think that might be even like a thing they always do, I'm not sure. It's more of like, you're kind of like awake and kind of like panicky because you're uncomfortable, you're in this situation and everything, and then you're out and you like just close your eyes and then you either open them right away and hello world, or you're like me and maybe you like come to but you can't open your eyes because they feel heavy or something. Could you have stayed awake if you want to or tried, or is that impossible? I would think it was impossible. And I'm one of those people that have the weirdest crap happen to me. In fact, I had just been set up to get sedated for dental, and I had gone to a different dental office and they had a different medication that they used. And I took it the night before, woke up, wide awake. I took the morning pill, and wide awake. And they gave me actually like 2 more medications there, and they could not get me to knock out. But that's pills. IV's a lot different, a lot stronger, a lot quicker. I don't think you can really fight it unless you have some like superhuman mutant powers, which I mean, I've never even heard of a case of people fighting it and being able to fight it. I mean, I've never even heard of that happening. So I didn't want to be awake, obviously, so I was okay for going to bed or going to sleep. But yeah, I don't think you could even fight it. I think it's just kind of like, it's too much of a dose quickly into your vein, into your system, so it kind of shocks you, like, boom, like you're out, I guess, would be an easy way. I don't think you can fight it, and I don't think you could stay awake or anything like that. Go ahead and get this part done with. I was going to show you my scars. Don't worry, I'm not going to show anything inappropriate, nothing scary, nothing bloody, nothing. So, I'm wearing like boxers so I could like pull this up. Let's see. So these are the scars 6 months out. You see, this is the one that gave me the most trouble, even though this is the one that usually gives people the most trouble. This one, I could feel it, it's raised. This one, it's raised, but it's slowly going down. I'm kind of pissed that it kind of screwed up my navel. And then the two on the sides just look like little, almost like scars from like acne or a little cut. So, I mean, I'm not worried about the scars at all. I was worried about them before the surgery, but they healed so great. And that's with the one that was bleeding and having like issues. So don't worry about the scars at all, really, honestly. I mean, I honestly am gonna try and find like a tattoo to like tattoo over them. It's supposed to be, I think, within like a month, totally like pain-free or whatever. Now, if you watched the whole video, which I know, God help you if you did, because it was very long. At the end, when I started feeling totally better, I didn't have any pain. I was like, okay, I'm great. I was off my pain meds, except for like an occasional like fever every once in a while. The only reason I was taking pain meds would just be for the fever. My dad passed. I'd already seen the follow-up with my surgeon, and he'd already taken all the like bandages off and everything. So everything was healed for the most part on the outside, and I was feeling great. My dad died, I think, on the 6th of March, so I was almost a month out. I was like about a week from a month out, so 3 weeks out of surgery. And so I had to drive there, or ride there. I don't know what the heck's wrong with some of these states, but they don't know how to pave roads. Especially through these 2 states that we had to drive through, it's like constant like jerking. And I just felt like, honestly, the whole car ride, I was just screwing up everything they did. It felt like I was being shaken to death. I was so pissed because I was like over the pain, over everything, feeling great, thought I was like totally done with it, and it felt like I screwed it all up with 2 car rides. Car ride there and a car ride back. It was like a 9-hour trip each way. I was crying over grieving, so. And I also had to sit up and like be very up and active and walking around and like, you know, good posture, good clothes, whatever. So I really felt after I got back from that trip that I had like worst setback ever. Top incision, it's right there. This one is the most painful because it felt, I mean, obviously there's muscles here that they have to cut through. When they cut through it, I don't know, I mean, the muscles have to grow back together. So, I mean, I understand that there's gonna be pain. Your muscles have been ripped, you know, stabbed, whatever, and they have to grow back together. But the car ride, the jerking and everything, it just put more tension, I guess, on the healing wound. I started going through like months where it would be like, if I was laying down, it'd be like really tender. I like could barely like press on it because it didn't feel like it was a hole or anything. It felt like just a normal muscle or anything, but it felt so horrible. It hurt. My cat likes to climb up on me. As soon as he'd hit that, I would like, you know, jerk or yeah, stop it, you know, whatever. Most of the sites I've looked at, people had gotten over that within 3 months. That took me like 5 to 6 months to get over. I don't know if it's because maybe I'm a slow healer. Maybe it's because I have other health problems that made it painful. I don't know. I think honestly the car ride shook the hell out of me and kind of just pissed off everything. If I hadn't had to do that car ride, I think I would have been fine. The pain that I was having just kind of felt like they were trying to separate again almost. A tightness, like I know in the last part of the video I was complaining because it felt like a band, like right there. It kind of felt like the muscles were like tightening up where the rest of my gut or whatever wasn't. So, I mean, I dealt with it. I brought it up to my gastroenterologist visit after my surgery and after the visit with my surgeon. It had been a couple months out, and he said that, you know, everything's healing together. All the nerves are reconnecting, kind of firing off type thing. It's normal. Now, I'm pretty good with it. I mean, it's not a great place to touch, but it's like kind of like a ow type. It's not like, oh my God, you know? I mean, it's just really weird. It's hard to explain. I don't know if it's just me because of my health problems or healing slow or whatever, but I did notice that for some reason took longer for me than like everywhere I read. And I was really pissed off about it. Sometimes it's weird. It feels like if I eat a big meal, it kind of feels like it's stretching almost on my bottom incision. I don't know what that's about. I have like gastro problems anyways, like IBS, so I mean there's always like bloating and stuff like that. I don't know if maybe that's contributing to it. The mystery pain, oh God. It's funny because every once in a while I'll have it a little bit. And I know it's either my gallbladder wasn't the cure for that or I'm just crazy. But I'll have like a little bit here, but I also, you know, it's right next to your incision, so honestly it could just be that. I'm trying to think of any other questions that was had. Yeah, sedation, it sounds scary. They make it scary, honestly, but you'll be fine. It will be either you opening your eyes and, you know, or you being kind of alert and then getting to open your eyes. Don't freak out if you're alert and hear things. It's not them operating on you. It's probably just the nurses around you because they're always like buzzing around and trying to move you and trying to, you know, get the stuff ready and everything. So if you have a problem with nausea, you may want to mention that. I kind of wish I hadn't, but at the same time, I wouldn't have gotten into surgery without throwing up if I hadn't. So I know they'd given me the patch by Mayer and Zofran, but Zofran always fixed everything and it did not with this one. And then something I think else also in my IV during surgery, but I don't know what that was. Would I have the surgery again? Of course. The gallbladder was like ruining my life. I could not eat. I just was like in constant pain. I couldn't do anything. So I'm very happy with how it is now. I mean, I'm very happy with the results now. But I think with any surgery, it depends on the person, it depends on past medical history, and also, you know, what kind of surgery it was. Diet has not had to change. And if I had to have to change any of my diet, it was for other reasons not connected to gallbladder. I haven't noticed any, you know, need for extra medicine for the gallbladder to make up for it. Haven't had to see my surgeon like since the follow-up, honestly. I mean, it's done. So I hope this was helpful. I don't know if I explained everything correctly. I hope it was helpful seeing my scars, because I know that was also one of the reasons why I did everything, is because I was like seeing scars either fresh or like a year or two old, and that just drove me nuts because I didn't know what the heck to expect. I'll try and hunt you down. Hopefully you didn't change your like screen name so that I can like link you this, and hopefully this helps you some. Don't be scared of anesthesia. It's not, I've been put under so many times. It's like, I mean, you always have like a little nervousness, but it's really not that bad. Don't go on any long car trips while you're healing, because I swear that just that screwed up everything. I was so mad. I'm still mad. I was doing so good. I was so proud of myself and everything, and then boom, bumpity, bumpity, bumpity. Oh God. Oh. Anyways, I hope this helps some. I don't know if I answered all the questions in a way you would understand, or I mean, I know it was correct for me, but each of us is different, especially when you take into account like age, other health problems, you know, etc., etc. Usually, if there's a problem, I'm gonna have it. So I kind of feel better telling other people, you know, it'll be okay, because I'm the minority. So it could be that you don't even you're not even nauseated when you wake up. You never know. They will want you. I know the hospital did not want to let me out of the hospital until I could prove that I wasn't going to power puke anymore. So I had to wait I forgot how many hours. It's in the video, somewhere in the video. But I had to wait hours to stop puking so that they felt comfortable with me going. So keep that in mind, that even though it's like X amount of hours surgery, I think they said that you might be there like a couple hours longer due to, you know, if you are nauseated, etc. You want to make sure you can walk on your own type thing, which I walked fine. I just freaking was nauseated and everything. It was really dizzy. I didn't want to do a follow-up until I knew everything was settled, and since I kept continually having pain in that one area and I didn't know exactly why, I didn't want to follow up and be like, oh my god, the pain's never stopped. It could just be me. I mean, never really had a huge incision through a muscle before, so everything affects this area. If you slump, if you stand straight up, breathe, everything. I wanted to make sure I was in the clear, and so thank you for asking questions, because it made me off my butt and make this video, because I kind of like remembered to, but I was like, screw it, I have other things I want to do. If you like this, hit the like button. If you want to, subscribe. I hope this helped. Bye.